Okay, well, so all, thank you for joining our first official Summitt Trucking Town Hall meeting. Sounds like we're probably going to have people joining us over the next few minutes. So if you guys hear bling noise like that, that's probably people just joining the call. I'm going to kind of give you all a brief agenda of what we're going to discuss this evening and what we're looking forward to. And, you know, this will be a work in progress, these town hall meetings, and they will find their home here at Summitt in a very specific way as we develop them over the course of the next few calls. So we have a guest speaker today. His name is John Schneider. I'll introduce you to him in just a moment. But we're going to talk about briefly, very high level, the new benefits package. This is a very important thing for all Summitt staff to really understand and you know, get engaged so they understand exactly what is available to them and what the new benefits look like, because it's completely different than what we've dealt with over the last 4 years. We're going to discuss briefly the new pay plan that we will be unveiling this coming week. Both the benefits information and the pay plan will be coming in the form of an email to all drivers and Summitt staff as well. We're going to talk briefly about paperwork from a driver standpoint and or folks in the office that are doing common checks and things like that. We're going to discuss a question from a driver as it relates to fuel in the Northeast and Love's truck stops. We're going to talk briefly about ADP and their online availability for W-2s. We're going to discuss briefly the chaplain program, and we're going to discuss that this conference call will be on the website for you or, you know, other significant others, spouses, whatever, to be able to listen to so that you catch this information even if you're not on the call today. So that's kind of what today's town hall meeting is going to sound like. And I am going to start by prefacing the new benefits package that we are doing coming February 1st is the official start date of the new benefits package, which includes health insurance, life insurance, vision, dental, disabilities, long-term, short-term, you name it. There's a whole slew of things. It's a comprehensive retooling of everything we've been doing. All of you know that over the last 4 years, basically health insurance is uncontrollable, both for Summitt and for you, in get less for more money over and over and over year after year. I think this year we're going to push back quite aggressively at that and do some really neat things. It's way out of the box. This is a major kudos to Mr. Summitt for really looking at all of the variables and options and what are all the ways we can make things better for you. So, there's a couple things that are very significant. Is there's going to be 2 plans, not 1. There's no penalization, smoker or non-smoker. It's the same price. I want all of you to hear from John what to expect when you contact him or his team, and I'm going to explain that in a little more. There are going to be many emails being sent out with mission-critical information over the course of the next 2 weeks. Please don't disregard them. Please don't look over them, and bypass them or delete them. Please read them because they have mission critical timelines in there and valuable information that will be very important to you. So, John's going to talk briefly about 3 deadlines over the coming 2 weeks. One is on the 19th, this Friday. Another is next Friday, the 26th, and the final and federally mandated deadline is the 31st of January. So let's discuss who John is. John Schneider. John Schneider is the owner and president of a company called Benefit Enrollment Services, Inc. And John has more than 3 decades experience in health insurance and benefit packages for employees at companies. He's become a master at dissecting the complex and presenting it in a simpler manner, and he has trained the team of specialists to be able to do that for companies like us. So they work specifically with companies our size, maybe a little bit bigger and a little bit smaller, but in our company size range. And John and his company come very highly recommended by some key people that Dave has been in relationship with for many years. So I'm not going to take anything from John. I'm going to let him share specifically the information he would want to share with all of you. But again, I tell you that we're in great hands with Mr. Schneider and his company and all of his consultants that help Summitt and both the company and the employees to really understand what it is that we've put together here and how the Summitt employees can take advantage of it and leverage it to their best ability. So without further ado, Mr. John, would you like to speak to those that are on the call today and those that will be listening to the call, in the next few days?
Well, I would, and I appreciate the opportunity this evening. Last 15 years, we focused our practice on communicating benefits and giving people clear, simple choices so they can be more informed, and then make a relaxed selection when they have to choose on the type of medical plan they have, as well as other benefit choices. But I must admit, sometimes my enthusiasm boils over, and I talk a little bit fast when I'm going to these programs. So, also, if you don't mind, if I go down that road, don't be afraid to kind of tap in and let me know that I'm kind of carrying the ball a little too fast. I want to make sure that we play this up so everyone gets a good handle on it. And then Thursday and Friday of this week, the 18th and 19th, I'll be on site going over communication meetings as well as answering questions. And I'll have 3 other benefit counselors with me that will kind of work with that process. So our first objective is particularly.
So there will be 4 of you on here on Thursday and Friday?
That's our game plan, yes.
Okay.
All those details aren't worked out, and I can't say specifically at this point, but we don't anticipate any issues with that.
Sure.
So what we'd like to do is to make sure that everyone has a medical ID card from the new carrier that shows that they have coverage as close to February 1st as possible. If you don't have one of these cards, it can be a little bit of administrative trouble to actually get access to care at a hospital. So our number one objective on that basis, and why we're trying to have this on a short-term goal on the 19th, to turn in as many election forms as we can on which medical benefit people might elect. So we're kind of communicate and actually take it and assist people to complete enrollment forms on Thursday and Friday of this week. And the reason why that deadline's there, it takes approximately from the 19th, once we submit this in to be processed, it takes about a week to a week and a half to actually generate the cards in people's names and then distribute those. So we want to have these cards as close to February 1st as possible. Those people who make a benefit election after this Friday the 19th will have a lot of opportunity the week of the 22nd in a variety of formats. All these plans are not written in concrete right now, but we'll have on-site counselors next week. We also have toll-free numbers people can call in, and they always have the opportunity to talk to Reggie as well. So we're going to assist the team at Summitt Trucking in communicating and also collecting the enrollment forms. The week of the 22nd, yes.
So John, if I could interrupt for a second. So what I understand you to be saying is that because of the fact that we are completely changing, it's not an extension of the existing Baptist Health Plan or a shift of that plan. That plan's going away. They're going out of the business. So we are engaging a new company, which is actually called North American Administrators and Lucent Clarity Insurance Company, as I understand. And because of that, every employee at Summitt Trucking will either submit a form that says, no, I don't want any coverage, or they will select one of 2 plans along with the rating that goes with it of which plan they would like. and then all of the ancillary products that might be, vision, dental, and things like that. So every employee will be touching this form and making an election of some sort. And what you're saying is that if they do it by the 19th, which is this Friday, then there's a near 100% certainty that they will have the right card in their hand come the 1st of February, so that if they do have to go to the doctor or hospital or anything, there's little or no interruption for them. The alternative would be the second deadline, which is the 26th, where if they do wait until the 22nd through the 26th, you'll still have folks here. You'll have ways for them to get a hold of you guys and have conversations, but the card may be delayed a bit because it's the next week's cycle, correct?
That's correct. So if someone were anticipating that they might need to go to the hospital or doctor on or shortly thereafter February 1st, then it's important that they consider taking a few minutes and completing that enrollment process this coming Thursday or Friday.
Okay.
If they felt they might want a little more time, talk it over with their spouse, be a little more, have an overview, then be able to answer specific questions to a benefit counselor, then we're going to be set up to handle that next week, the 22nd, anticipate through Friday, the 26th. And we're going to be able to answer questions, this Thursday and Friday, but we're going to have a lot of people that are, on a tight time frame. And so we're trying to offer a variety of ways that people can have their questions answered so they can be informed. And this is the open enrollment period. So now, between now and January 31st, that's when, by law, the open enrollment period closes. So everyone can have a redo, and they can change their elections now. They can add a spouse. They can increase life insurance. They can decrease coverage. They can add all the dental, vision, disability, life insurance, critical illness. They've got options to pick those coverages up. The great news is the medical plan is going to be more affordable. There's no real takeaways in the voluntary benefits, and across the board, there's benefit improvements. So I'm very excited to be part of that process, and we just want to make sure that everyone has an opportunity during this open enrollment period to have the kind of experience they want. So if someone is fairly certain they know what they want, we've got an easy process to have them complete that on Friday the 18th and Thursday the 18th and Friday the 19th.
Okay.
We're going to take some time over the weekend and talk with your spouse. We would encourage people that when we have one-to-one opportunities and people there, they can do a three-way call, pull their spouse in that may have questions. So we just want to make sure we're a resource of information so people can get the plans that are important to them.
Okay. So something that Reggie just alerted me to, and I just want to make sure that everybody's clear on this. This applies for everybody that has been employed for 60 days or more. If you haven't been employed at Summitt for 60 days, your open enrollment becomes day 61, I believe. And perhaps, Reggie, you can shoot me an email and give me an idea, or maybe John, how long is that open enrollment when somebody's been here for 60 days? Do they have 30 days then thereafter to make that election, or 1 week, or 1 day? I'm not sure how that part works. This is for everyone that has been employed at Summitt Trucking for at least 60 days or more. They qualify to get on one of these plans now.
Yes, in other words, if they were hired in mid-December, they would first become eligible. They have to have 60 days of employment. And I understand there's a first of the month date that may apply. Reggie can confirm that. And so for someone hired December 15th, they would not have ended their 60-day period until the 15th of February, and they would come on. In fact, if the first month following is the date, which I believe it is, we can clarify that would be March 1. So if someone
Okay, so yes, then it would, Reggie confirmed that it's the first day of the next month following their 60-day anniversary. So if it's sometime during January that you hit your 60 days, it would be February 1st. If it's sometime during February that you hit your 60 days, it would be March 1. If it's sometime during March you hit your 60 days, it'd be April 1, so on and so forth, as I understand it. Thank you, Reggie. Thank you, John.
What's the next topic we'd like to discuss on the benefits?
Well, you can share with everybody the fact that we'll have a nurse practitioner on site that can operate as a primary care doctor for many folks, and that there is no network in this new plan, and that they have the opportunity, just go into some of the broader details of what they can expect. I think that having the nurse practitioner on site at no cost to every Summitt employee and their family is a huge benefit to this plan, and part of what makes this thing so creative.
I was very impressed with that approach. I think we're improving access to primary care. And so colds, flus, minor conditions can be very well handled with the on-site nurse practitioner. And she can actually have a prescription written for certain everyday situations like flus or colds or allergies, those type of things. So this is going to really improve access to care. To compensate with times when you're not at business hours at the facility, you have access to a process called telemedicine. And so what this means is, if you're after business hours at evening or maybe before, typically 7:30 in the morning, wherever the business hour is set up, you have the ability to call the toll-free number and request a phone consultation with the physician that practices medicine in your home state. So it gives you 24-hour access to primary care.
Great. So if I were to paraphrase it, I would say that as one of the things that Mr. Summitt was very committed to is having somebody on site 40 hours a week during the week that is a primary care doctor for basically everybody at Summitt Trucking and their families. So if you're here local, or if you're a driver and you're coming through and you need to see the doctor, you can see this nurse practitioner right here at Summitt Trucking at the Clarksville yard. This person, as John was describing, can write scripts, can refer you to a specialist. In many cases, we'll have what's called a class 1 or level 1 drug there in the facility, and can hand out a Z-Pack or certain antibiotics, amoxicillin for the kids, whatever it might need to be at that time. And this person will also be able to do our DOT physicals. We'll also be able to collect our specimens for DOT drug testing. That's not set up yet, but that's what is coming with this person being on staff here at Summitt Trucking. So that's a huge plus. If you're a driver out on the road and you get an ear infection, or you get a sore throat or something like that, and you need some help, you can call in if it's during the day. And what John was saying is to supplement that. So first off, that benefit is for everyone. The other, and there's no copay as it relates to it. It's completely a service that Summitt is offering to all of its employees and their families. The teledoc that Mr. Schneider was referring to is available if you're on one of the plans, John, or will that be available to everybody as well?
Klaus, my understanding is you need to be on the medical plan with North American Administrators. It's part of the medical plan.
Yeah, that's what I thought. So there's the teledoc, which is after hours, would be available to you, or the telemedicine line would be available to you if you have one of the medical plans. But you can use the nurse again at no copay. It's just a service as being a part of the Summitt family. And then dental and vision benefits will remain the same as you have now, but they will be offered through NAA, North American Administrators. So those are some of the benefits. And then, John, there's going to be short-term, long-term. Some costs will be less, some costs may be slightly higher, but the value is much better, and it's a better service for the employee here at Summitt. So it's a good move for us as a whole. there anything specific around those that we need to address, or are we done with your
I'll
part?
hit on some of the highlights on that, Klaus. But one
Okay.
point I want to mention about the telemedicine, that is also available to your dependents. So if you
Okay.
had a sick child that had an ear infection, you need to get that pink amoxicillin prescription at Walmart or Walgreens or wherever you want to go. You can request a phone consultation for your child. You'll be talking to that pediatrician. They call back on average in 20 minutes, and they can call in that prescription to the pharmacy of your choice. So that's a widely used source. Summitt Trucking is an early adopter of having a on-site clinic. I've only seen that available in city governments and large employers over 5,000. So this is just a great enhancement to give access to primary care. Now, in regards to the other benefits that you can personally round out, that you have choices, we've got good news across the board. We've got, if you want to buy life insurance on yourself, you can now buy up to $130,000 of coverage for yourself without medical questions.
Okay. Wow.
You can buy up to $50,000 for your spouse without medical questions for your spouse. If your spouse is in fairly good health and really just mostly do normal activities, they can actually elect up to the same amount that you buy. So,
okay.
You can actually buy quite a bit, typically up to 5 times your income. The amounts are very high.
Okay.
And this is an improvement on the plan. We also have some enhancements on the disability program, both the short and long term. And we're also providing ongoing coverage on dental and vision, as well as the critical care plan. So across the board, there aren't really any benefit takeaways. In some instances, the people at younger ages on some of the disability and critical care can lock in a rate that they can carry as long as they want to. And some at the very older end of the spectrum may pay just a few more pennies per week, but they also have long-term continuation options as well. So
yes.
Truly, I'm excited about having the opportunity to have a more affordable health plan, as well as a great plan to back that up in case you have other things that come along.
Okay. Okay. Excellent. Excellent. So, John, if you're complete, you may hang up if you'd like. If you'd like to stay with us, I'm going to go on through the other agenda items. And, my commitment was to have this last less than an hour. So I'd like to probably wrap it up in about 20 more minutes. I don't have really that much left to share, and I think we can probably get through that in less than 20 minutes, unless I get some texts or emails in on from some folks, which looks like I have been getting some.
Well, Cliff, I'm going to mute my phone, but I'll be available in the next 20 minutes in case someone has a thought. In the latter part of the call, I'll be available to answer.
Great.
Point of directions. Thank you.
Okay. Very good. Thanks, John. So, guys, a couple of the questions that I'm going to read here. Will there be a way to make the insurance plan selection electronically by the 19th in case we cannot make it in? Excellent question. So, yes, on Wednesday, I will be emailing to every driver and every Summitt employee what is called an enrollment guide and an enrollment form. And ultimately, you can read through the guide. You could call in to John's staff because you'll also have an 800 number to his staff. You could call in to Reggie, and any one of those folks can help you and walk you through that enrollment packet. And it's about a 2 or 3 page where you check this box, check that box. And once you're done with that, you just sign it and you can email it back into us. You can scan it in and email it, or take a picture of it and email it back to Reggie so that she can get you enrolled. So absolutely, you can get done by the 19th, no problem. We'll have the staffing here specifically to help you with that. So yes, another question, will he discuss cost or wait till in the office? So we're not 100% complete with that. Wednesday when it comes out, you'll get all the costs and the specifics. Yeah, so the nurse practitioner at the office, you don't have to have Summitt's insurance to see, as in I have Summitt's insurance and my family doesn't. Yes, that is correct. This is the nurse practitioner, whether you do or do not, or your family does or does not have insurance that's with Summitt, you will have the availability to see that. Now, we're going to be very clear who is family. Family is a spouse. Family is a blood child. Okay, so no stepchildren, no children-in-law, things like that. So a blood child and a spouse, those are the two that would count as family members that can get care from the nurse. Says, hi Klaus, is there an age limit on family for the on-site nurse? It's a very good question, and I don't even know if I have a good answer. I would think that, like anything else, if somebody has a particularly precarious health condition or situation, they're probably going to be referred to a specialist anyway. But generally saying, I would say no. So yes, I entered the nurse and the telecom for spouse or dependents. Pre-existing conditions covered. That's again a very good question. I don't have 100% the answer. Generally, yes, pre-existing conditions are covered in most healthcare plans of this nature. But there may be certain circumstances that I'm unaware of exactly that may be precluded from that. So we will find out, okay? So yes, about the family, yes, that's what we're doing with the nurse on the family, got that. So how do I fill out the paperwork by this weekend if I'm over the road and don't have access to a printer until I'm home this weekend? Well, the answer to that question could be that I may go ahead, and for those of you that have only access to a smartphone and not really a printer and you want to get through this and get this done by the 19th, I'll make a commitment to put it into something called Right Signature, which is an electronic signature tool where you can check the boxes and type in your name and stuff like that on an electronic form right on your smartphone. And then you can submit that, and that form is legally, it's the equivalent of your signature on there, even though you physically can't sign the form. So I'm willing to make that a possibility. I don't want to send it to everybody, or actually, you know what? I can probably send it to everybody in the company, and it'll be a link, and you will just put your name in there. And when you put your name in there, you'll submit it once you're done filling the form out. And that would be an alternate way to printing it out, filling it out manually, signing it, and faxing it back or emailing it back. So part of the process will be for me to send out that link to a Right Signature, is what it's called, RIGHT signature. Okay, so I've answered all the questions that have come in so far. Let me go on with the other parts of the agenda. Let's see here. Okay, we're going to talk briefly about the new pay plan. The new pay plan coming out will affect owner-operators, will affect company employees. There are very neat things that we're going to be doing inside of this pay plan. One of the biggest things, of course, is going to be pure cents per mile. But we're also going to do some very neat things like use a couple of things as an example. If you're out on the road and we ask you, and you're willing to take your 34-hour reset, away from home and keep right on going the next week, so that would be called going out for 2 weeks at a time, we'll pay you for that 34-hour reset. So you'll earn, I believe it's $200 extra as a company driver to take your 34 on the reset out on the road. If you perform at a certain level of miles within a 4-week period, and we're not going to measure these things monthly because they're too difficult to measure monthly. We're going to measure them for every 4 weeks, every 28 days. So there will be actually 13 bonus periods in a year, and there'll be a safety bonus, and there's also a performance bonus, number of miles that you'll see on there. We are also going to be putting into the pay plan something called the Olympic Club, which many of you that have been around for a while probably remember, and it comes with itself a an annual bonus provided you met the criteria of the Olympic Club bonus, and you'll move up the ladder as you perform. There's also components of the pay plan that will well, I'm gonna make sure that the pay plan comes out on Wednesday with the benefits package so you guys can see it in detail. There's just too many different variables in there and too much different information to try and hit on all the points. But just to suffice it to say that there will be a lot of very inspired things in there. Mr. Summitt spent a long time really working through this and has engaged the suggestions and help of a lot of folks. And as all of you know, and this is probably one of the things that this new pay plan will lead into, Summitt Trucking is in desperate need of hiring more drivers. There's more freight than there is drivers to move the freight. And what we really want at Summitt Trucking is for the drivers to say, you know, that this is the greatest place that they have to work at. And if that were true, they would be simply recommending and referring many of their friends and acquaintances that are also truck drivers to Summitt Trucking. And you drivers are our #1 recruiting tool. Now, as you know, by the emails that I've sent and that Mr. Summitt has sent out, that Tim Gim, who was the director of our operations department, has taken on the responsibility for all of recruiting and orientation and basically processing drivers in. And that's a huge need and has been a missing at Summitt for a long time, where we've not had a quality and effective recruiting process. And Tim's going to spearhead that. And he also understands what it is to work at Summitt as a driver. He understands the needs that Summitt has as a company. He can explain to a driver what their experience will be like working with Summitt Trucking. And all of you could literally probably help us double the size of Summitt Trucking overnight with referrals. And the reason the referrals may not be coming is because you can't say that, hey, Summitt is the greatest place that I've ever worked at. So I want to get that feedback from you on wherever you would say that it's not an awesome place to work. And I will be the first to say any place you work has its issues, right? It's how do we handle them? How do we handle the issues? What do we do about it when things, either we make a mistake or you make a mistake? Do we treat you fairly even though you've made a mistake? Do you treat us fairly when we make a mistake? And do we rectify our mistake quickly? All of those things are important. How do we make you feel? How do we make you think that we think about you as a truck driver? You know, your world is a very unique one. And something I say to drivers all the time, and I say at the dispatch as well, a driver spends his whole or her whole day driving down the road thinking. You know, I kind of joke and say sometimes you probably solve world hunger 3 times over in the one trip that you're on. And most drivers kind of chuckle and sort of nod. Well, a dispatcher and working here in the office at Summitt is a little bit like running around after greased pigs. And if you kind of have that mental picture in your head when you call in here, it will be a lot easier for you to understand when somebody maybe doesn't pay as much attention as they should. And I would really encourage you as a driver to please emphasize something when you do need their attention. Say, look, I'm not just calling in to have a chat. I really need you to listen to what I'm saying. It's important. I'm not just calling to chit chat. You know, so get their attention, get them to pause for a second, because it is a bit like running around after greased pigs in the office at times. Having said that, you know, the whole point is that we are working hard to put things together to make it possible for Summitt to grow, for us to bring on more drivers, for us to have our drivers and our employees feel as if the company is really looking out for your best interest, and that we can feel like each of you are looking out for Summitt's best interest. Couple of things that I'm going to move on to from here. Let's see if I got any text on this subject matter so far. I got an LOL. Yes, somebody identifying with that. So, so somebody asked, are we getting new trucks soon? That's always part of the conversation. There are major forces at work in the insurance industry around trucking, and they will probably dictate some of these changes that are going to happen with trucks on safety and performance components in the new trucks. So obviously, Mr. Summitt's always been a proponent of having the latest and greatest. And right now, the technology is changing so fast that it's very difficult to make a commitment right now when something's going to change too soon, right? So we are working on it. Are there new trucks on the horizon? I won't say that there are today, but I do know that we have an agenda over the next 2 years to start to replace the fleet. The owner-operator pay plan, had an owner-operator ask about it. The new owner-operator pay plan will be an increase of a dime. So for those of you that are owner-operators on here, you'll be going from $1.05 to $1.15. Another thing I will say is that this pay plan, once you see it, will go into effect on February 4th. That is a Sunday that begins the month of February, basically, and everybody will see these changes take place at that time. So you'll complete that week on February 11th and get paid the new pay rates. Let's see, February. The 16th of February is when you'll see the paycheck from the 4th through the 10th, and that will be when you see that new pay. Now, a couple quick questions or a couple other points that I want to make sure everybody knows about. If you go on to the ADP app, or not the app, but the ADP website, you can see on the website, you go to the Myself tab. And once you're in the Myself tab, you click on the Pay tab and then the Annual Statement tab, and there will give you the option to see a W-2 or 1099. Click the W-2. It takes a couple of seconds to load. So you can't do it from your phone, or it doesn't work properly from your phone or well enough to do this. But if you go to it from a computer that maybe has a printer hooked to it in case you need your W-2 again and want to print it out, you can go again to workforcenow.adp.com, log in, same place you go to see your check, click the Myself tab again, click on the Pay tab and then the Annual Statement tab, and there you'll see a link to the W-2. You click on W-2 and up it comes. Might take a few seconds to load, but that's how you can get duplicate W-2s. On the website, there is a new link to the chaplain program. As an introduction to all the chaplains, and we're going to be doing weekly videos that will be on the chaplain page for you to watch. This particular discussion today is going to be, as I said, is recorded, and it'll be on the website for you to link into to listen to tomorrow or the next day, to have your spouse listen to as it relates to the benefits package. We're also going to be posting, not this week, but next week or next weekend, over the weekend, this coming weekend, an introduction and an explanation to the benefits that John and his team will be doing in person here. We're going to record one of those and put it on the web so that drivers can see that and help make some educated decisions. We are working on fuel. Had a request about fuel in the Northeast and how difficult it is to get into certain fuel stops up there. Right now, I would recommend that you do your fueling in such a way where you're fueling before you go into the Northeast, at least that far, that you have enough fuel to get out. And I know sometimes it doesn't work, but ideally you'd want to do that. And somebody requested if we're going to be doing any business with Loves because of the rewards program. I've heard that several times, and I know we've looked into it. We've had a couple of conversations around it. I don't have anything to share around that yet, but I did want to address the fact that somebody did ask about that. Last thing I'll talk about, and you've seen a couple of emails from me, is paperwork. You guys have done a phenomenal job as drivers to get the paperwork in a timely fashion compared to what it was like a year ago. So our goal is to have all paperwork in within 24 hours. And some of the things that are really important are if you're trying to get a reimbursement. So first, let's talk about a comm check. If we issue you a comm check, even if it's for the repair of a trailer or truck, if you're an owner operator and it's for the repair of a trailer, without the receipt, that comm check is equivalent in our eyes to just giving you money. So it's going to come out of your check, whether it's a settlement to an owner operator or a paycheck to a driver, until that receipt is scanned in on the order that you were working on when you incurred that expense. So we have to get the receipts in. So when we issue you a comm check, please know that you are responsible for that comm check until you scan in a receipt. And then when you are scanning in a receipt, especially if you're looking for reimbursement, make sure that we're really clear what you purchased. So we've had receipts scanned in and we don't have any idea what it is. Was it oil, candy bar, bottle of water, death? Don't have any idea. It has no description on the receipt. So you need to make sure that you put your name on it. Any receipt that you want reimbursed, we need your name on it. We also need to make sure we know what it is that you bought if it's not clearly delineated on the receipt. And on every single piece of paperwork, our request is that you put the order number that you either just completed or getting ready to start, or that you're on active right now. Put that order number on the receipt, on the bill of lading, on everything. Put it on everything that you're going to scan in. On the BOL, it is absolutely mission critical that we get the trailer number. Most cases, they put the trailer number, but it's mission critical that, number one, that is the correct trailer number. And if it's not on there, please make sure it's on there. Okay? So that's what I've got for this month's town hall meeting. Got a lot of great texts coming in. We're not going to turn up the speed on the trucks to 70 miles an hour. Somebody asked that. That's, again, an insurance restriction. May we turn it up at some point a mile or two? Maybe, but it really depends on what the new insurance is going to require of us. And the new insurance for the trucks is not till next year, but or towards the end of 2018. But that's the next major hurdle that we have. Healthcare was a big one. We're now through it. We know what we're doing. We know we have something really quality to offer to everybody. Pay plan was another major thing. We now have something to offer everybody. It will affect single driver, team driver, an hourly city driver, owner operator. Will affect everybody comprehensively across the board and give everybody opportunity for spiffs and bonuses along the way. And the next thing is our insurance for the actual trucking part of the company. And that will dictate a lot of what we can and can't do. And will even dictate, the kinds of trucks that we need to look forward to replacing the existing fleet with, or what kind of features we'll need to have on those trucks, so on and so forth. Okay, so somebody did say that they can see the tax statement on their phone app. At the bottom of the tax statement, there is a download tab. You can see the W-2 just like it's supposed to look. You still go to the Myself tab. So great, somebody's figured out how to get to it that way. So you can get to it from a smartphone. Awesome, very good. Well, that's it for me. It's 7:45. So you got one more text. Is layover pay going to be any better? Yes, layover pay will go from $75 to $150, and we will have a half layover at 75 and a full layover at 150. So yes, that answers that question, I hope. But you'll see all the particulars when that comes out. So my request is wait till Wednesday, and you'll get it in an email. It'll be clearly laid out. All of the specifics will be in that. At that point, you can reply back to my email with specific questions. Between now and then, please give me a break. Don't ask me a million questions about it, because it'll be all in that email coming out on Wednesday. So that's it, guys. I appreciate everybody for participating. And owner-operator detention pay is part of it. So, all right. Well, I will get those emails to you guys on Wednesday. Please, please, please remember, you're going to see a lot of emails from me over the course of the next 2 weeks. Those emails will be stuff that Reggie needs me to send you, that North American Administrators needs me to send you, that John Schneider and his Benefit Enrollment Services company will need me to send you, and some of it'll be stuff that I'm sending out to you that's mission critical about timing on certain things. Federal law says January 31st, that's it. So on the benefits, please don't procrastinate. We physically cannot do anything. It's not a Summitt deadline. It's a federal deadline. We cannot do anything after January 31st. If you want to have uninterrupted service, you really need to try and get this done by the 19th and at the latest, the 26th. And it does put a lot of pressure on us if you wait until the 26th. So I know I'm pushing a little bit on you guys, and we will get you all the information in your hands on Wednesday. John and his team will be available along with Reggie Wednesday afternoon, Thursday, Friday to make sure you can get what you need done. And I'll even put it on electronically for you so that if you want to click the link and do it right on the online, you can do that. You don't even need to print anything. All right, all, have a good night. Again, thank you so much for joining, and look forward to talking to you all very soon. Come and say hi when you're in. Thanks, guys. Bye-bye.
Thanks, Klaus.